Good afternoon and welcome to our Oak Bend Medical Center Happy Hour podcast. My name is Donna and I am your host. I'm very excited to bring back a very special guest today as we speak about dealing with depression and anxiety during the pandemic. Dr. Anzaldua is a board certified by the American Board of Family Practice. He is also a fellow of the American Academy of Family Physicians. He also has been in private medical practice in the Sugar Land area since 1985. He has been part of Oak Bend Medical Group since its inception. In March 2020, Dr. Anzaldua was appointed as local health authority for Missouri City, Texas, primarily to serve as a consultant to deal with the COVID-19 pandemic. He has also served on the board of directors representative for our local chapter for the Texas Academy of Family Practice. Well, welcome, Dr. Anzaldua. You've been very busy.
Yes, it's been quite the challenge throughout the past several months, maybe more like 2 years or so.
Yes, and we're seeing such an increase of depression and anxiety since the beginning of the pandemic. Can you tell us, is that a derivative of the pandemic or?
Well, yeah, I mean, depression and anxiety disorders have increased substantially around the world since the beginning of the pandemic. And, here in this country, we're no exception. We're still part of that. And even locally here in Texas and the Houston area, there's some studies that show that the emergency department visits have increased for mental health conditions such as suicide attempts, opioid overdoses, actually all drug overdoses, intimate partner violence, and even child abuse and neglect. Other studies have shown an increased use of prescribing medication for anxiety and even depression. So all in all, this is a major concern. And a lot of it has to do with the fallout of COVID-19 pandemic.
Do you think there's certain elements of the pandemic that contribute to this?
Yeah, I think that, the daily increases of cases, we've had already going on our fourth wave, and a lot has to do with restrictions on social mobility, and that this has definitely impacted and caused an increase in depression and anxiety symptoms. Also, people have had problems in the past that predate the pandemic, such as depression, anxiety, PTSD, non-prescriptive recreational drug use, addiction such as opiate addiction. And I think all these are major contributing factors. The people that had severe illness from COVID-19, especially those that required ICU care and prolonged hospitalizations, I think were also at risk for getting these things and definitely contributing factors.
We can all understand that. It appears that depression and anxiety, though, has not been to any specific age group. It seems to be kind of all over the place. What are your thoughts?
Well, yeah, I mean, I think depression and anxiety can affect anyone regardless of their age, depending on the circumstances. So I'll give you some examples. For instance, some studies have shown that women may be at greater risk of depression compared to men. And they think that's because women in general are more likely to be impacted by social and economic consequences because of the pandemic. Of course, there's adults. During the pandemic, about 4 in 10 adults in the U.S. reported symptoms of anxiety and depression, which represents an increase from the 1 in 10 adults that were reported prior to the pandemic. And of course, these symptoms are just made worse for those already suffering from depression, anxiety, and even substance abuse. Adults in households with job loss or lower incomes are more likely to develop symptoms of mental illness compared to other people. So people that had income loss or job loss seem to be at higher risk. The other thing we've seen is that these issues have also impacted on our adolescents and our youth. So young people seem to be at greater risk for depression and anxiety, and again, especially females. So schools and home confinement related to the pandemic are felt to be contributing factors. So young adults are more likely to report substance abuse and even suicidal thoughts. And then, of course, there's children. The very tools that we use to decrease the risk of the pandemic, such as social restrictions and lockdowns and school closures, may very well have threatened child growth as well as social and cognitive development in those children. And the more severe the experiences, the greater the risk of developmental delays and health problems that follow them into adulthood, such as cognitive impairment, substance abuse, PTSD, depression, and anxiety. Also, the pandemic has disproportionately affected the health of communities of color. Minorities and those of lower socioeconomic status have faced problems accessing mental health care to begin with. So the pandemic has just made this challenge worse. And then lastly, there's the case of the essential workers that have continued to be affected by the pandemic, especially those at greater risk of getting COVID-19 compared to other non-essential workers. So essential workers such as hospital personnel, nurses, doctors, are more likely to develop symptoms of anxiety and depression, started with the pandemic, or even increasing their substance use and even suicidal thoughts.
In a recent study, it was found that those who had COVID tended to have depression. The level of depression was increased with the level of COVID severity. And you kind of touched on that, but kind of wanted to see if you wanted to expand on that just a little bit more.
I think COVID-19 illness can lead to depression even after a person has recovered. No one really knows the exact link between depression and COVID-19 or the correlation between an increase in depression and the level of the severity of COVID-19. So more research is still needed to understand this process. It's been reported that greater than 50% of Americans have reported symptoms of depression several months after recovering from COVID-19. And those with more severe COVID-19 symptoms were more likely to have depression. And people that seemed to be at higher risk were those who required hospitalization and who experienced increased social isolation. Research has also shown or demonstrated that many who recovered from COVID-19 also reported PTSD, anxiety, obsessive compulsive behavior, and insomnia.
Dr. Anzaldua, mental health is such a personal thing. I think over the years, no one's kind of really wanted to admit that we have depression or anxiety, or we can't maybe feel like we can't handle life. But what should someone do who is experiencing any anxiety, suicidal thoughts, depression, personality changes?
So many people may have concerns that the symptoms of anxiety and depression there is during the pandemic. And, that seems like it's appropriate for people to feel these symptoms. But these feelings or symptoms may be mild and just last for a very short while. But sometimes feelings of hopelessness and sadness, getting angry, getting irritable, a sense of hopelessness, and just being afraid or having fear may last for a longer period of time. So people may experience trouble concentrating on the simple things or routine tasks, have decreased or even increased appetite, insomnia, or difficulty performing routine daily activities. So when these signs and symptoms last for several days in a row, it's really time to ask questions and get help.
Would they reach out to their physician or a friend, a pastor?
Yeah, I think that the first thing is to, for people to call their primary healthcare provider, or if they have a mental health professional already that they use, get their guidance and get their advice. This may involve a face-to-face appointment or even a remote visit, such as telemedicine. People can also contact a lot of agencies are out there, such as the National Alliance on Mental Health, Substance Abuse and Mental Health Services Administration. They're out there. People are feeling suicidal or thinking of hurting themselves. They should definitely get help. There is an agency out there, the U.S. National Suicide Prevention Lifeline, and the number for that is 1-800-273-TALK. That's 1-800-273-TALK, T-A-L-K. Or they can access their web chat at suicidepreventionlifeline.org/chat. But again, I think they should always think about starting with either their healthcare professional, their PCP, or a mental health care professional if they already have one. And people can also contact someone in their faith community, such as a minister or a pastor. They can contact their employee assistance program, EAP, if their employer even has such a program in existence, and ask for counseling or referral to go see a mental health professional. The other things that may help, although not meant to be a substitute for professional care, are self-care strategies, which may be beneficial, such as getting a lot of rest, getting a lot of sleep, eating healthy, avoiding tobacco, alcohol, recreational drugs, and even caffeine. Limit screen time, such as social media and TV channels, especially those channels that spend a lot of time discussing COVID-19 issues that may be controversial or even confusing or misleading. People should set aside time for themselves, relaxation techniques to reduce anxiety, yoga, deep breathing exercises, and meditation. And also, they shouldn't forget about their family and their friends. They should get support from connecting with their family and friends.
These days you turn on the news, you go on social media, you hear about all the increased anger. Do you think that's a byproduct of the depression and anxiety?
Anger definitely can be a sign of either or both. It can be a sign that the person is experiencing, a serious case of depression or even anxiety during the pandemic, and basically they're having trouble trying to cope with the situation and should get help. A lot of times anger can lead to people expressing their anger in terms of violent terms, and that's not good. So I think if people are having problems with dealing with their anger or just can't control themselves, they should definitely seek help.
As all this COVID calms down, hopefully a little bit and resolves, and we go back to whatever normal is these days, do you think some of this depression and stuff will just disappear?
You know, it's very unlikely that these symptoms will just go away on their own, especially like I said before, if these symptoms last for a very long time or just keep getting worse. Also, just kind of hoping and praying that things are just going to get better on their own is not a wise thing to do because, again, things just may get worse over time. So again, if people are concerned or if they're experiencing worsening of their symptoms, they should really seek help.
I agree. Dr. Anzaldua, we've had so much information given to us about COVID, vaccines, preventions, but we don't hear nothing about follow up to COVID. Some people have had COVID for 30 days, some have had more or less. What do we do now? We're over it.
Yeah, well, we should always keep in mind is that we have never experienced COVID before. This is new to all of us, and we're just kind of treading on uncharted waters. It's kind of like we get flu every year, so we pretty much got that down. We know how long it generally lasts. We know about vaccines, and all that. But COVID-19, we just don't know what the future holds, especially when you consider that there seems to be mutations occurring a lot. So I think that's part of the problem. It's a very complex issue. We just don't have a complete understanding about the long-term effects or the lingering effects of COVID. In fact, a lot of people have what's called long COVID, where they have symptoms way past the time that they've actually recovered from the illness. So long COVID refers to the persistence of symptoms 4 weeks or longer after they actually had the illness. And a lot of times this long COVID can be associated with a broad range of symptoms, mostly affecting the lungs, the neurological makeup of a person, their heart, and we've already discussed psychological problems. Some of the common symptoms of long COVID are fatigue, shortness of breath, chest pain, loss of taste or smell, although we saw that mostly with the Delta variant, not so much with Omicron. And another big one that I see in my practice is something that people describe as brain fog. And that's difficulty concentrating, where they have a sense of confusion or disorientation. And of course, we've talked about anxiety, depression, post-traumatic stress disorder, and even insomnia. And there are a lot of other symptoms that have been reported in long COVID. And, it's on, I will refer you to the CDC website as they have a lot of information on this. Some people may experience only a few symptoms. They may experience only one symptom. They may experience more than one symptom. And it seems to vary in severity from person to person. Some people have very mild cases of it. Other people have very serious cases of it. And this is important because sometimes symptoms can get so bad, people have trouble returning to work or even returning to school. So even if a person has recovered from COVID-19, they should discuss any concerns with their primary healthcare provider if they are concerned about having lingering symptoms, as they may require further evaluation.
I would think if you've never had a physical, or if it's time for your physical, this is the best time to start or have it done.
I agree.
And I hear you do those in your office.
Yes, we do, every day.
I think it's important that we make sure we're okay. Make sure our children are okay, especially if they're going to play sports or get back into activity. It never hurts. Dr. Anzaldua, I always enjoy having you on. I'd like to have you back again to discuss more subjects because you always bring some interesting process. And a question I ask everybody, because this is the question of everybody on the mind, so I'm going to throw this out at you. The COVID vaccines. There is such a controversy of why would I get a COVID vaccine if I'm going to get COVID anyway or anything. And I'd like you to have your take on it because I think it's good for our listeners to hear.
Yeah, there is a misconception out there that just because you got the COVID vaccine, that you'll never get COVID. And that really is not true. And frankly, that was never even said from the science point of view. So just because you got the COVID vaccine, it's not like it's a shield that's shielding you from ever getting COVID. So people can still get infected. The question is, will they get sick from it? And that's where vaccines come in. So there are some people who have gotten sick from COVID after vaccination. We call those breakthrough cases. But here's the deal. It turns out that the majority of people that required hospitalization or even died were people that were admitted to the hospital that were unvaccinated. So even though people have breakthrough cases after being vaccinated, these people did okay. Yes, they got sick. Yes, they had to stay home, isolate for a few days, but they got better. They didn't go to the hospital. They didn't have to be admitted, and they certainly didn't die. So I think all in all, there is definitely a purpose for vaccinations, and I'm a great supporter of getting vaccinated.
I thank you for that. And I will share, I vaccinated and I ended up getting COVID. And I was very happy that I had chosen to take the vaccine because it wasn't as bad as my son who chose not to get vaccinated. And he really had a really tough time.
Yeah.
So I too believe in the vaccine.
Yeah, and of course we'll never know, but there's a good possibility, Donna, that had you not gotten vaccinated and gotten COVID, that the outcome may have been completely different and for the worse. I'm glad you're better. I'm glad you're here. And I do look forward to another podcast with you.
Wonderful. So I want to thank Dr. Anzaldua for joining us today, and a big thank you to our listeners for tuning in. Beginning now, set an intention and a relentless focus on living your life as the greatest person you can be in all situations. Please join us next week.
Thank you for joining us today on Oak Bend Medical Center Happy Hour podcast. We hope you enjoyed today's broadcast and invite you to email us at oakbendhappyhourpodcast@obmc.org with any questions or topics that you would like for us to cover. Remember, you can find us here each Friday at 5. Until next week, be mindful and stay healthy.